Corrections in the CNA State Exam. How to make corrections during the CNA exam through Prometric. A presentation brought to you by foryourcna.com. So you've signed up for the CNA State Exam. And you're probably a little worried.
Will I pass the test?
You're as prepared as you can be, but the test is still a test. Your concern is valid. The fact is, only about 70% of CNA students in Florida pass on their first try. No, that statistic wasn't meant to scare you. But being realistic about the test will help you prepare. If you understand how the test is structured and what they're looking for when you're being graded, then passing the test becomes easier.
I'm afraid that I will fail because I am so nervous. I hate tests.
During the exam, the Nurse Aid Evaluators, or NAEs, expect you to be nervous. Being nervous is perfectly fine.
But I stutter or laugh when I'm nervous. I'm afraid I will fail for that.
If you stutter or laugh, it's okay. You need to be serious about the test, but they understand nerves too. It's perfectly understandable to be nervous during testing. You're not expected to do everything perfectly.
Sometimes when I practice, I forget what I'm supposed to say. Will that fail me?
If you forget what to say, it's okay. Slow down, take a moment, and think it through. You aren't graded on how polished you sound or how smooth you make it look. The reason that you are nervous is because you think you should be able to do the skills as smoothly as your instructor did. But you don't have the same experience they do. You are just a beginner. So there's no way that you will do the skills as well as the instructor does until you've had the same amount of experience. The NAEs don't expect that, and neither should you. Have realistic expectations on your skills performance. For the exam, you're only graded on entry-level skills performance. The CNA exam allows you to begin your work in healthcare, so the exam doesn't expect you to show that you're a pro at performing the skills. There's a big difference between beginner level and master level. In other words, it doesn't have to be perfect or even pretty to pass.
But what if I forget a supply that I need to do a skill?
If you forget a supply, it's okay. You can always get it when you remember. Just wash your hands first because you cannot touch clean supplies with soiled hands or gloves. But during the exam, you can correct your mistakes.
What if I forget a step and remember it later?
If you have to go back and do a step you forgot earlier, it's okay. Just don't ignore your mistakes. You must correct them. When you're being tested, this is not what the NAEs are focused on. Forgetting supplies, doing steps out of order, or forgetting what to say isn't the reason that most people fail.
It's not? Then why do people fail?
Because they didn't correct their mistakes or they didn't follow the care plan.
The care plan?
The care plan gives you instructions for caring for this patient. All care plans will be different. The test is evaluating your understanding of how the care plan works and why it's so important to follow those specific instructions. If you don't follow the care plan, you're not being a good CNA, and that can cause you to fail. After all, if you don't understand what a CNA is supposed to do, then how can you be a CNA? You might be able to give the very best bed bath in the whole world, but knowing how is only half your job. Knowing when and how to do the skill on this patient are even more important, and that information can only come from the care plan. So to pass the state exam, you must follow the care plan exactly. The care plan will give you specific instructions for performing each individual skill. For instance, this skill requires that the radial pulse is counted for 1 full minute. So not counting the pulse for 1 full minute goes against the care plan, and that can cause you to fail. The care plan also tells you to record your readings, so not recording the reading could cause you to fail. Plus, you can make corrections during the exam.
Corrections?
Corrections. For example, let's say that you were taking a radial pulse for the exam. As you perform your skill, the NAEs will grade your performance using a checklist. In fact, this is the exact checklist that Prometric uses. When you do a step correctly during the exam, the NAE will put a check mark next to the step indicating that it was performed. But if you miss a step or you perform it incorrectly, you don't get a check mark. These items without check marks are called deficiencies. This is what the computer will use to determine if you pass or fail. But if you remember to do the step later, you can still get credit for it. Here's an example. Let's read this care plan together. This care plan states that the patient will be lying in bed for the skill. We are instructed to count the patient's radial pulse measured at the wrist for 1 full minute and record our readings. You must do the opening, the skill, and the closing to successfully complete a skill for the exam. You must do all the steps of the opening in order and all the steps of the closing. Think about these steps before ending your skill to make sure you have done them all. In this example, the CNA forgot to wash her hands during the opening.
Uh-oh, what if I didn't wash my hands? Wouldn't I fail?
Not if you remembered and corrected it. If you think you made a mistake or forgot something, you have to address it. The worst thing you can do is ignore a mistake or think that the NAEs didn't see it. If you make a mistake, correct it.
How do I correct a mistake?
Simply say, "Correction, I would have," and then tell them what you should have done.
Don't they need to see me do it?
Usually, but it depends. If they don't need to see the step, they will tell you. For instance, if you get all the way through a skill and realize that you forgot to wash your hands at the beginning of the skill, you have to correct that. You could just say, "Correction, I would have washed my hands at the beginning of this skill." You wouldn't have to start the entire skill over to demonstrate that step. You would just stop and wash your hands when you remembered, and then tell the NAEs when you should have done it to get credit. That way, the NAEs have seen you actually wash your hands, and you have verbally corrected when it should have been done. But let's say that you forgot to dry the patient's back during a partial bed bath, and you didn't realize it until the patient has been dressed in a gown and everything has been put away. You could just say, "Correction, I would have dried the back before giving a back rub and dressing the patient." If the NAE needs to actually see you do it, they will tell you.
When can I make corrections?
Anytime during the skill. As soon as you realize that you've made a mistake, stop and correct it. But you can also correct yourself at the end of the skill. You should always review the care plan after you have finished the skill to make sure that you didn't make any mistakes. Make any necessary corrections before you end the skill. Because once you say your skill is finished, you cannot make any other corrections. So take your time and think about the skill before you say you're done.
I feel much better knowing I can correct my mistakes.
Just remember to follow the care plan and correct any mistakes, and you'll do great. Don't forget to watch our other videos. You might find the video on the care plan informative. Good luck on your exam.